Hello everyone, I am Gaurav Pating. My topic is antimicrobial drug. The topics to be covered: prophylactic use of antimicrobial. First one is the prophylaxis against specific organism. Second one is the prevention of infection in high risk situation. Third one is the prevention of infection in general. And second one is the failure of antimicrobial therapy. Prophylactic use of antimicrobial. First one is the prophylactic against specific organism. The first case will be rheumatic fever. Benzathine penicillin is a drug of choice for preventing infection by group A streptococci which cause recurrence. Second case is a tuberculosis. Children, HIV positive and other susceptible contacts or open cases needed to be protected. Isoniazid alone for 6 months is recommended. Third case it will be Mycobacterium avium complex. HIV or AIDS patient with no CD4 count may be protected against MAC infection by azithromycin or clarithromycin. The fourth case it will be meningococcal meningitis during an epidemic, especially in contact rifampin, ciprofloxacin, ceftriaxone may be used. The fifth case it will be gonorrhea or syphilis before or immediately after in contact. Ampicillin, the drug of choice it will be ampicillin or ceftriaxone. Then the recurrent genital herpes simplex, acyclovir prophylaxis may be given when 4 or more recurrence occur in year. Then third one is a malaria. Traveler to endemic areas with high transmission rate may be covered by mifloquine and doxycycline. The fourth one is the influenza A2 or H1N1 swine flu during an epidemic, especially in contact with oseltamivir. Then the cholera, the drug of choice it will be tetracycline prophylaxis may be given to close contact of a case. The recurrent genital herpes simplex, acyclovir prophylaxis may be given when 4 or more recurrence occur in year. Then the malaria, traveler to endemic areas with high transmission rate may be covered by mifloquine or doxycycline. Then the mm, first topic is with prophylaxis against specific organism. HIV infection, workers are to be protected by tenofovir plus emtricitabine or plus lopinavir or atazanavir. The offspring of HIV positive pregnant women with tenofovir plus lamivudine plus ifa orange. Then the whooping cough, non-immunized child contact during the incubation period. The drug of choice it will be erythromycin or azithromycin can abort clinical disease. Then the plague, doxycycline prophylaxis is recommended for contact during epidemic. Then the fourth one is a pneumocystis jirovecii pneumonia, transplant recipient or immunosuppressant. Then leukemia or AIDS patient may be protected by cotrimoxazole. Then second case it will be further divided into prevention of infection in high risk situation. The first one it will be dental extraction, tonsillectomy, endoscopies cause damage to mucosa, harboring bacteria and induce bacteremia. The second case it will be catheterization or instrumentation of urinary tract. Prophylaxis with cotrimoxazole or norfloxacin decrease the risk of urinary tract infection. The third one it will be to prevent the recurrence of UTI in patient with abnormalities of the tract. Cotrimoxazole or nitrofurantoin may be given on long-term basis since the organism mostly in E. coli. Then the prevention of infection in high risk situation. The fourth case it will be chronic obstructive lung disease, the chronic bronchitis. The drug of choice it will be ampicillin, doxycycline, ciprofloxacin have been used to prevent the acute exacerbation but are of doubtful value. Then the fifth one it will be immunocompromised patient receiving corticosteroids or anti-neoplastic chemotherapy or immunosuppressant after organ transplantation. Neutropenic patient, the drug of choice it will be penicillin, cephalosporin and aminoglycoside or fluoroquinolones are often used to prevent respiratory tract infection and septicemia, but incidence of supre-infection is high. The third case it will be the prevention of infection in general. First one it neonates especially after prolonged or instrument delivery. The second one it will be to prevent postpartum infection in the mother after normal delivery. The third one it will be viral upper respiratory tract infection to prevent secondary bacterial invasion. And the fourth one is to prevent respiratory infection in unconscious patient or those in on respiratory infection. Then the classification of operative wounds with increasing risk of infection. First one it will be clean elective non-traumatic surgery, non-visceral or tract, respiratory, GI, biliary, genito-urinary entered, no infection at site, no break-in technique. Then the clean or contaminated. Otherwise, clean and contaminated, other clean but emergency surgery or elective surgery with opening of any viscera, tract but minimal spillage, no contact with infected material or minor break-in technique. The third one, it will be contaminated, gross spillage from the GI tract, opening of infected biliary or genital urinary tract, penetrating injury is less than 4 hour old, grafting on chronic open wound, major break-in technique. And the fourth one is be dirty, opening of abscess or purulent site, preoperative perforation of GI respiratory, genitourinary tract, penetrating injury is a more than 5 hour old. Then the second topic, it will be further classified into failure of antimicrobial therapy. The success of antimicrobial therapy can be measured either clinically in the term of improvement in symptoms, signs, or microbiological or as a eradication of the infecting organism. The second one is build antimicrobial may fail to curb an infection, fever, or there may be relapses. This is infrequent when antimicrobial therapy was begun in the first place on sound clinical and other or bacteriological basis. When a real or apparent failure of antimicrobial regimen occur, the diagnosis and the therapy should be reviewed. First, the first one, it will be improper selection of drug, doses, route or duration of treatment. Second will be treatment begun too late. Third one, non-compliance by the patient, and fourth one is the failure to take necessary adjuvant measure. Example: drainage of abscess, emphysema, etc. Removal of renal stone, other foreign bodies or infected gallbladder. Adjustment of proper urinary pH in cases of UTIs, cavity closure, control or diabetes, etc. Then the fifth one is will post-host defense as in leukemia, neutropenia, and other cause, especially if a bacteriostatic antimicrobial agent is used. The sixth one, it will be infecting organism present behind the barrier, such as a vegetation on heart walls, inside the eye wall, blood-brain barrier. The seventh one, it will be trying to treat a treatable virus infection or other cause of fever, malignancy or collagen disease. And eighth one, it will be presence of dormant or altered organism, the persister which later give rise to relapse. MCQ, which of the first one, it will be the what is the primary purpose of prophylactic use of antimicrobial. The first option, it will be a treatment of established infection. Second one is a prevention of infection in individual at risk. Third one, eradication of normal flora. And the fourth one is a palliative care of for infectious disease. The option is B, prevention of infection in individual at risk. The second MCQ is which of the following situation is common indication for prophylactic antimicrobial use. The option, it will be first is a routine dental procedure, second is a confirmed bacterial pneumonia, third one is a viral upper respiratory infection, and fourth one is a chronic non-infectious disease. The solution, it will be A, routine dental procedure. Question 3, which is the crucial consideration when the selecting antimicrobial for prophylaxis? Option A, maximizing broad spectrum coverage. Option B, minimizing potential side effect. Option C, using the highest possible doses. On option D, ignoring patient history. The solution is option B, minimizing potential side effect. Question 4, which factor contributes to the development of antimicrobial resistance related to prophylactic use? Option A, short duration of prophylaxis. Option B, strict adherence to guidelines. Option C, frequent and prolonged use. And option D, limited spectrum antimicrobial. The solution is option C, frequent and prolonged use. Question 5, in which of the medical setting is prophylactic antimicrobial use often recommended? Option A, general public health program. Option B, emergency medicine. Option C, palliative care facilities. And option D, long-term psychiatric care. Solution is option B, emergency medicine. So thank you.